Hello. All right, we are back with Dr. K for some more breast cancer information and some questions so we can continue to learn about this important thing during October Awareness Month, right? Okay, so now breast cancer is extremely rare in men, but this year around 2,800 men will be diagnosed with invasive breast cancer and 600 will die from the disease. So what are the screening recommendations for men? What's that look like?
So sure. So there are currently no definitive screening guidelines for men. However, if a man feels a lump, pain in their breast, they must see their doctor and they must come see us. We can then do what we call a diagnostic evaluation, right? They're symptomatic. And so we would go ahead and get them a mammogram, we would get them an ultrasound, and we would thoroughly evaluate the area.
Is it recommended that they do self-breast exams like women or no?
That's not typically something we recommend by the books,
Okay.
but it is important, like you said, to pay attention.
Yes.
So we want them to be aware of their body and not ignore anything,
Right.
because that's why this ends up being so progressive for men. They just ignore it. They're
Yeah.
embarrassed about it. They don't seek care.
Right.
And so, just like you said, it's the awareness which is what leads to the whole early detection.
Absolutely. Now, I know a lot of people who have gone in for their mammograms and a week or two later, they get, this happened to me, you get a letter that says you might need further screening and ultrasound. So what, describe as to why somebody would need to do that.
So this happens all day, every day, right? You get a letter and you say, we need you to come back.
Yeah.
And you just start worrying. You think,
Yeah,
I
you
have
get a
this.
little panic.
Yeah.
A little panic comes over.
Yeah.
Yeah.
Why are you calling me in? That was
Right.
already a screening mammogram. Aren't you done?
Right.
So what that means is that we took a look at your images and we saw something that needs further evaluation. It could be a mass, it could be some calcification, some tissue. We just need some further imaging, what we call diagnostic. We get different views. And then we also do diagnostic ultrasound to use all of our modalities. Okay, so I don't want you to be scared. I want you to think about it as I'm getting additional extra evaluation of my breast. The majority of the cases, they end up being normal. There's very few breast cancers come out of that. But just think of it as the doctor is asking me for a second look.
Yeah.
To take some extra eyes on my breast.
Make sure you take advantage.
Yeah, take
Yeah.
advantage of that.
Is there anything that we can do to lower our risk of breast cancer?
Okay, so there's lots of things we can do. Okay, so let's start with what you can't do. Okay, so you can't change your age,
Right?
you can't change your family history,
Right.
you can't change your family members.
Right.
But what you can do is you can change your diet.
Interesting.
You can exercise.
Yeah.
Should a woman have a baby, you can do breastfeeding.
Yeah.
Alcohol.
Breastfeeding lowers your risk of breast
Yes.
cancer. Wow.
Yes. It's very important,
Okay.
actually. So when someone delivers, they're encouraged for multiple reasons to do breastfeeding.
Right.
But from our perspective, we're recommending it to decrease your risk of breast cancer.
All right. I breastfed Elvis for 2 years, so that's good to know.
Benefit to you.
And diet. Could you quickly
Yeah.
touch on that? Like, what are maybe some top 3 things you can do for your diet?
I mean, diet is going to be right. Eat well, balanced meals, the whole same thing.
Lower sugar, lower alcohol.
sugar, low alcohol. Don't smoke.
Yeah.
Proteins.
Yeah.
Right, and so all of that combination along with exercise will help you. It just helps your metabolism.
Yes. Okay.
Right, that's what again, another fun part of getting older.
Yes.
Another
And it
problem.
slows down. Yep. All right.
Exactly.
Okay.
So these are all things you can do to help yourself.
You're the best. Thank you so much for taking the time to answer these questions.
Absolutely
I'm sure
welcome.
everyone will appreciate to learn some more knowledge about everything and take advantage of everything that you've shared with us. Thank you so much.
Absolutely.